It is indeed my pleasure to be with the students of MPH program at IIPH Delhi. The placement cell of IIPH Delhi has scheduled this talk on looking at career opportunities for public health professionals. You would agree to me that this is a $1 million question for all of you. Am I correct? Yeah. This is the most important question for you, that what next? What do you want to do? As a student of public health program, you would be graduating Masters in Public Health a year after. You already finished 2 semesters and now you will be transiting to the 3rd semester, and then you have project work, and maybe next July you will have your MPH degree in your hand. And therefore, I firmly believe that in next couple of semesters, next few months, you will have these questions in your mind. I have acquired MPH. Now what next? What do I do? Because the degree and qualification is a certificate that you acquire. But what next? Where and how do I find a job in public health? That's also an important, where do I go and find a job? And what kind of job do I find in public health? Which kind of job is suitable for me? Looking at my own aptitude, which job is more suitable for me? Because somebody may have a research aptitude, somebody may be interested in going to public health practice, somebody wants to go to, into the policy arena. And even in the subject areas also, somebody mentioned that wanted to get into the antimicrobial resistance. Somebody said, I wanted to work in adolescent health, reproductive health, or maternal health. So there could be different areas to work in public health. So what kind of job is suitable? Looking at my own aptitude is also important. Next could be that, should I go for a PhD program? Because MPH is stepping stone in the area of public health. It is necessary, but it is not sufficient to make the career in public health. And therefore you would be interested, that somebody may be interested that after immediately MPH I would like to explore some PhD in some interested area. Somebody might think that let me spend a couple of years in public health, and then I would think of a PhD program or a DIR-PH program. So that kind of thinking could be there, and you might be, trying to address this important question. What are other options? Maybe that after doing MPH, I would like to switch gears, and maybe I prepare for civil services, and then getting into the civil services with public health background also provides me an opportunity to contribute significantly towards the nation building. Maybe that I wanted to completely change the gear, and after MPH, I would like to go for another master's program. Maybe a management master's program, go to Kennedy School of Business and or any other best of the management schools and completely change the track. But having acquired public health background would be useful, because I wanted to pursue further career but on a different track. So there might be thinkings on those lines. But what matters really is, what is my goal? What is my dream? And the passion that you have for the public health. And therefore, you must ask a question to yourself, that what really you want to do in your life, and align that with identifying career and opportunities in that context in the area of public health. And therefore, what is your goal and what is your dream remains an important area. What I would do in next maybe an hour or so, I will talk to you on 4 important areas. The first one is, I will try to build a case of public health by explaining you how the scope of public health is expanding and changing over a period of time. Next, I will also try to explain you the number dynamics, because it's equally important to understand the need, demand and supply paradox. Because finally, when you talk about career opportunities, it's a labor market which decides the demand for a career in a particular area, that from where the supply is coming. What are the opportunities available? How many positions are available? What kind of positions are available? They're completely dominated by the labor market. like any other field for that matter. You go to management or law or medicine or engineering, so this field will also be dominated by the dynamics and forces in the labor market. So we need to also understand that number dynamics. The next is then typically looking at what are the options available in the context of public health. The career opportunities, those are available if we really wanted to pursue the career in public health. And finally, I would also like to take an opportunity to talk to you on the placement strategy and placement processes at our own institutes, at PHFI and IIPHS. So these are the four areas that I decided that I would talk to you, because they all are critical and important from the perspective of what kind of career that you are keen to choose in public health. So let's begin with the first section on building a case and understanding the expanding and changing scope of public health. You have to remember that you are the public health professional of a 21st century. You have entered into the field of public health in 2016-17. And your contribution to the field of public health will be there for next minimum 30 to 40 years. So I would like to emphasize on you that you also need to factor what are the emerging opportunities in the area of public health in 21st century. You cannot only think that what kind of opportunities existed in public health and what kind of opportunities are currently available, but one must also vision and one must also think that down the line next 10 years, 20 years, 30 years, what kind of job opportunities would be existing in public health. And in that context, it's extremely critical to even talk about how the scope of public health is expanding and changing over a period of time, and what are the determinants which actually are responsible for this changing scope of public health. But before that, I would also like to emphasize on where does India stand today from the health front. And why I'm talking about this is that I see public health as an instrument to respond to these challenges. And therefore, when you think of a career in public health, you also need to see that where do I go for as long as my contribution for improving the health of the people of this country is concerned. That would also be an important factor which would determine your journey in the public health in next few decades. And therefore, 3 slides on where does India stand today on health front. We need to respond to the aspirations of 1.3 billion people. You are in charge of the health of 1.3 billion people today. And of course, it will increase over a period of time. And therefore, we need to see that how do we respond to the aspirations of the people of this country. When you talk about aspirations of the people of this country from the health perspective, you would also see that high rates of maternal and infant mortality rate. India does not have a good record if you look at the infant mortality rate and maternal mortality ratio. Take an example here. The recent estimates of infant mortality rate, 38 per 1,000 live births in India. NFHS 4 data is just released a couple of months back. What's Thailand is saying, that's 12. Sri Lanka 13. Even the countries like Nepal and Bangladesh and Botswana, they are performing better than us. Small countries, not very developed countries, but their performance on these indicators is better than us. And same is the story for even immunization for that matter. If you look at NFHS 4 estimates, 62% is the full immunization coverage rate, which is far below than other Asian countries and other smaller countries, even in Africa also. It's not only the indicators are poor in terms of crude indicators like infant mortality rate or maternal mortality ratio, but if you look at from the perspective of equity, the record is equally bad and challenging. A girl baby born in Madhya Pradesh and Chhattisgarh is 5 times more likely to die in the first year of life as compared to a girl baby born in Kerala maybe, because the infant mortality rate is 5 times for the girl children in Madhya Pradesh and Chhattisgarh. And therefore, we can certainly say that in the lottery of life in India, it matters where you are born, because your survival is decided by the place where you are born. Is an example of inequity existing within the states, between the states, even within the states you would see far differentiation between districts, urban and rural areas, certain blocks. So these are the public health challenges in this country. The burden of infectious diseases, tuberculosis, the number of tuberculosis cases in the country, we are the highest in the world. If you look at the burden of undernutrition, 40% of our children are undernourished. And Ghana is 14%, Thailand is 7%, and Brazil is 2%. If you look at the rising burden of non-communicable diseases, like 65 million people are suffering from diabetes, and it is said that India is the capital of diabetes. Smoking-related deaths presently are more than 1 million. The average age of the first heart attack, if you compare with India and the western part of the world, is a difference of around 10 years. It's 50 in India, which is 10 years lesser than what happens in other parts of the globe. Air pollution, and would like to specifically mention, because we stay in Delhi and Gurgaon, and you know that Delhi is one of the worst polluted city, and we compete with Beijing, and the air that we inhale is absolutely polluted. 1.6 million premature deaths, 49 million disability adjusted life years, and 9% of the national disease burden has been attributed to the air pollution. Again, a matter of concern. So these are our important public health problems, and I picked up some important problems to tell. We need people trained in public health to respond to these challenges. Relative per capita disease burden a couple of years back, which was reported in Global Burden of Disease. You can see Brazil and China and India and Sri Lanka. See the difference. There also we have a challenge. So India's health problems is a matter of concern. Do you agree? It's a matter of concern. Independently also, and in comparison also. If we wanted to compare our indicators with other countries also, it's a matter of concern. And no nation can develop unless we have a healthy nation. Health and education are the two important pillars of any country. We talk about, India is emerging economy, India's economic growth is rapid. It will only pay dividend to us unless we ensure that the people of this country are educated, people of this country are healthy. And for being healthy, what we need is that we need to respond to challenges that we talked about. All these challenges can and ought to be confronted and effectively responded to. Then and then only we will have the healthy population and healthy India that we talk about. And we see public health as an instrument to make the people healthy. Because when we talk about public health interventions, they are all directed towards making people healthier. How do we improve the health of the people is our motto. Is not that? We wanted to see that the people are healthier. Our infant mortality rate gets down. Our disease burden gets reduced. Life expectancy is increased. And not in terms of numbers, but in terms of quality of life is also improved. So all these parameters indicates that public health is an instrument to advance this particular agenda of making people healthy. And at this juncture, I would like to mention the definition of public health. You would say that after 1 year you are telling us the definition of public health. But there is a purpose behind this. Why I am talking to you about presenting these two definitions of public health. They are being presented from the scope perspective, because we will be talking about the career opportunities in public health. So what public health does, therefore, becomes an important aspect of deliberations. And if you look at the first definition which came up in 1920 and Winslow's definition, that is absolutely popular definition, preventing disease and prolonging life and promoting health, and that too, efficiency through organized community effort. It talks about preventing diseases, it talks about prolonging life, it talks about promoting health. It means that it covers such a broad arena. It covers so broad arena basically. It's not like a clinical medicine that you diagnose the disease and treat patients. And if you talk about even the levels of prevention also for that matter, if you talk about preventing diseases, the primordial prevention, primary prevention, secondary prevention, tertiary prevention, if you see the spectrum, it covers such a vast arena. Everything related to the health. And let's see another definition that is even much more broader. And this is the one that actually has been articulated in this century a few years back in 2010, which talks about what we as a society do collectively to assure conditions in which people can be healthy. So broad, Take an example of air pollution for that matter. So we as a society collectively do, like as a government or other stakeholders, to ensure that we inhale pure air, clean air. Is a contribution to reducing the air pollution or effects of the air pollution. In that relationship, it is important to see that the conditions that, we talk about the conditions that we people live are made healthier, and, where we can live and grow and enhance our life. Much more broader definition. If we really address public health from the perspective of these definitions, this broad scope would require a diverse and multidisciplinary workforce. Will it not require? Can any one discipline, a demographer or a nutrition expert or maybe an expert in infectious diseases can solve all the problems? No. So we need people in public health trained in different aspects of public health. And therefore we say that we need a diverse and multidisciplinary workforce. Even if you look at what do public health professionals do? It's an illustrative example because there could be hundreds of activities that the public health professionals would do. But I picked up randomly to show you that so much of a variety of the work that the public health professionals are engaged into. And they advance the public health mission by multiple ways. For example, from educating those at risk about the ways of preventing disease, that's a job that public health professionals do, to inspecting restaurants and looking at the food safety and other issues, to tracking down sexual contacts of a person with sexually transmitted diseases, to identifying the patterns of disease and conducting epidemiologic investigations and outbreak investigations and responding to challenges around pandemics, to working with legislators to draft the policy, like for example for smoke-free work environments and so on. N number of examples. Somebody mentions adolescent health, somebody mentions maternal health. Such a broad spectrum of area and work that you can be engaged into as a public health professional. And therefore we say that multidisciplinary and transdisciplinary. There's a movement actually. Multidisciplinary to interdisciplinary, and from interdisciplinary to the transdisciplinary. The nature and approach of public health has helped us to identify applications in much more wider sectors. And you would appreciate this when we talk subsequently about how you can apply principles of public health much more even beyond public health and other sectors too. The cross-sectoral application of public health enhances the opportunities to work in public health. Even you can work in different sectors which are closely related to the public health, but predominantly may not be the part of the public health. And from that perspective, it is important to understand applications in other sectors too, that where you do find. Now, it would be appropriate at this point in time to also to talk about who is a public health professional then. We're talking about cross-sectoral linkages, but who is a public health professional? And this is the definition that I picked up, this is the definition which has been reported as a part of one of the reports. A public health professional is a person educated in public health. So you all are educated in public health, you have an MPH qualification, you all are public health professionals, or a related discipline, a demographer, a biostatistician, a nutrition expert, health and hospital management, epidemiologist, because there are some specialized programs also that people are trained in those specialities. And I'm talking that because they will also compete with you for the jobs. Therefore I'm talking about a much more broader arena that we talk about. Who is employed to improve the health through a population focus? So again, a definition of public health professional is also much more wider, much more broader, encompassing much more, so many aspects related to and beyond public health. And therefore, these are all can be called as public health specialists. You would find from behavioral scientists to program managers, to veterinary physicians, to occupational health nursing professionals, to policy analysts, to molecular biologists, to health managers, to the food safety experts, even to the town experts and trade experts. Now we are talking about smart cities. Can there be any city which is a smart city but is not the healthy city or is not the health-friendly city? Can you call a smart city where you don't have footpaths to walk? Can you call a city where you don't have open spaces for physical activities like you have jogging parks or gardens and where you run around? Can you call a smart city where you won't get 24 hours safe drinking water supply? Can you call a smart city where the pollution levels are high like Delhi or any other city? So when you talk about even smart cities, now because there is a concept and talking about the smart cities in this country, there's a lot of public health aspects involved into that. And from that perspective, even the town planners are important. Trade experts for that matter. We talked about the experts in health financing also, in taxation policies. We know that in globalization, the impact of taxation on the health of the people. So we need people trained in those areas also and to work in those areas also. So there are multiple jobs available from the perspective of where are you trained, how are you trained, and in which discipline that you are trained. And therefore we say that public health can be considered a discovered discipline. And why I am saying that this is a discovered discipline, because it is not the choice that initially we had, but a choice embraced later on in one's life. I am formally trained in medicine. I did my medical graduation, so I was a medical doctor. So I was trained as a medical doctor. Then I did my MD in community medicine and then, went on doing my PhD in epidemiology and then came into the public health. But if you ask me, initially I was trained as a medical doctor to treat people. Am I not correct? We have colleagues here from dentistry background that they were trained as dentists. They entered into the field of public health. We have colleagues from even veterinary sciences, Ayush background. Some of you have life sciences background. Some of you have maybe management background also. Now you are entering into the public health, but initially you might have been trained in some discipline, but this is the choice of profession that you embraced at a later stage of your life. And so that's the context of a discovered discipline. In the first section I emphasized on you that public health has much more broader scope and applications. From the perspective of even definition of public health, it would tell you that there is a much more wide scope to work and engage into the public health. I also emphasize about the current situation of the country so that you would understand there is a tremendous scope to work in public health. Because if so many challenges are there, obviously we need people to be trained. If the country would have been absolutely healthier, then what would have been jobs for us? No job, because everybody is healthy. But everybody is not healthy. We have a burden of communicable diseases, non-communicable diseases, air pollution and this and that. And that too much more burden as compared to other parts of the globe. Therefore we need more people to be trained in public health to deal with these issues. Am I not correct? If the country which is much more healthier, they may not be requiring expertise in those areas. But we need expertise in vector-borne disease control. We need expertise in tuberculosis. We need expertise in program management. We need expertise in entomology, zoonotic infections. You pick up randomly any thread of public health and you would find that country needs expertise in that area to work into. So the whole emphasis of the first section was to actually emphasize on expanding scope of public health. And some part of changing scope of public health we will continue to talk about when we'll talk about the 21st century challenges, and down the line next 10 years, 20 years, what kind of profession and what kind of jobs would be available to our public health professionals. But before that, let's understand the number dynamics. Let's understand the need, demand and supply of public health professionals in the country. Let's first talk about the supply of public health professionals, because you are a part of supply. There is a market. Sometimes we as public health professionals do not like the language, but this is the language. It's a labor market, and we don't feel that I'm not personally compatible. But that's how the dynamics is there. It all depends on demand and supply principle. And so from that perspective, let's talk about supply of public health professionals. And whatever I am saying, you would find that, and because this presentation will also be shared with you, you would find on most of the slides, there are references quoted at the bottom of the slide, so that you can refer to those references for much more detail on whatever is presented on the slides, number one. Number two, I will also be sharing, and now sharing on this slide only, some of the documents also, the snapshots of some of the documents. The point that I am trying to make is that whatever I am going to speak to you is absolutely research and evidence based. We have done a study of everything when we talk about the jobs are available or jobs not available. We say the supply side, these many number of institutions are producing graduates of public health. So everything is evidence based and research based, and these are the three reports that my colleagues have worked and produced. One is on the MPH programs in India. We thoroughly studied, that time it was 23 institutions a few years back offering MPH programs in India, and we reviewed all those 23 institutions very thoroughly, their MPH program. Second is about public health education in India, and third report is an India report, and because it's an India report, because we did a study and we looked at three professions: medicine, nursing and public health in 5 countries: India, China, Vietnam, Thailand and Bangladesh. So this is a 5-country study. We used to call it a 5C study, and I was involved in this 5C study and was leading the effort in India. We looked at 3 professions, medicine, nursing and public health, from the job opportunities point of view and from education point of view and infrastructure and need and required, a very comprehensive analysis. So these 3 reports are available in the library also. The hard copies are available, and you can refer them. But the purpose of presenting is that everything is evidence based. Numbers speak. India has 459 medical colleges producing close to 63,000 MBBS graduates. I don't say that MBBS graduates are typically public health graduates for that matter. But MBBS graduates, they join the primary health center, they get into the public health, the typical health systems. From the perspective of that, this number has been mentioned. But MD in community medicine, like, and this is every year, this number is an intake capacity. And the output is generally considered as somehow 3 to 5% less than the intake capacity, because some of them, leave in between, some of them may not get through, some of them maybe some other reasons also. But you can consider it because the output capacity is difficult to procure. So we actually considered the intake capacity, annual intake capacity, like MD program in preventive and social medicine or community medicine. So it's 850 graduates are produced every year. So every year this number is added to the pool of public health professionals in the country. MD in community health administration, tropical medicine or health administration, that number is 48. MHA, again from the medical colleges. Then several diploma programs are there which are related to public health. So those numbers are also mentioned. If you look at the MPH programs in India, we have listed 46 MPH program with the capacity of around 1200 graduates being produced every year. So there are 40 institutions in India which offer MPH programs, which includes our institute also. You have some programs specific to epidemiology, because again you would contact, like for example, a district epidemiologist position. You would also compete with the epidemiologists who are produced in the country. Health management and administration, more than 50 institutions, so it's almost 58 institutions and producing close to 2,500 graduates trained in the area of health management and administration. Hospital management and administration, so many institutions. Public health management, the PGDPHM program that we have, one of the programs here, there are 11 institutions and producing 870 graduates. Of course, some of these graduates are also the nominated candidates by the states. So they go back to the system. But they are added to the pool of the public health professionals, they are added to the people who are trained in public health. Similarly, some of the areas like in occupational health or nutrition or biostatistics, there are some distance learning programs. DNB, National Board of Examinations, they also offer DNB programs related to public health, so that number also gets added. So this is what is the annual intake capacity of these institutions, and maybe with some few percentages here and there are produced and added into the pool of public health professionals every year. And the purpose of presenting this slide is that if you look at these numbers, you are one of them and you have to compete with them. These are the hard realities of the life that we must know. So this is supply side is important. But I would also like to mention here very critically, because it's a supply side. It's not only the numbers which are critical and important. The extent to which we are able to improve the health of the people depends on a larger part rather upon the quality and preparedness of the public health workforce, which in turn, if you look at from the perspective of education, is also dependent upon the relevance and quality of education and training. The point that I am making is, it's not that all are the best institutes. It is also not true that all the institutes are not good institutes. There are some good institutes, there are no so good institutes. But in addition to saying that there are certain good institutes, some not good institutions, but as the students of my institute, my suggestion would be that you are spending 2 years of life with us. 2 years of life is a very long period. It's quite a significant amount of time that you are spending here. And therefore you must ensure that you are acquiring those skills and competencies which make you a proficient public health professional for the 21st century. And in this context, you must be demanding, you must also be actually engaging and contributing on your side, but you must also be demanding so that you are among the best of the lot that is produced in this year. You need to be, because there is a large pool, so you need to be best. You need to have some additional hip pocket competencies to tell that, yes, I have these competencies. Yes, I am good. In these areas I am good. And therefore, you need to focus on certain additional ways of also building your skills and competencies, which we'll talk about later. But here the point is that education and training also matter. It's not the only numbers, the quality is critical and important. Having talked about supply side, let's talk about the need and demand. Because one has to also see that, where is the demand. The supply is coming one side, but the labor market will be decided by the need and demand of public health professionals. These are the two reports, both were produced before the PHFI was created. I was the author on both the reports. It was written in 2003. We did the work with the support from World Health Organization, where me and one of my colleague from another institute in Maharashtra, Professor Garg, we looked at the overall scenario of public health education in the country and the career opportunities and how the scope is expanding and where are the jobs available. So that was the work supported by WHO. So the first one, Blue Report, is the status paper on that, and the second is the WHO document which was prepared based on this report as a WHO document which actually talks about all these numbers. Although the numbers are quite few years old, however, it is important because this work we initiated, because this before that there was hardly any attempt in this country to actually look at the public health workforce more systematically, strategically in a research mode. And because this was a unique experience of looking at the public health workforce in the country, we thought that it's important to mention here. And what we had observed that time is that scarcity of data on public health professionals. There is no information available. We did a lot of literature review and talked to several agencies, including government and other stakeholders. Serious shortage of public health professionals in the country. And around that time, the McKinsey report had come out with the estimates which tells us the need of public health professionals to the tune of 10,000 per public health professionals were required. In fact, this McKinsey report was one of the complementary document when the PHFI creation was debated and discussed, and the schools of public health was required in India, and so early discussions of 2003 and 4 when the PHFI was established in 2006. So this McKinsey estimates and the work that we had done was the basis of actually thinking on those lines whether this country needs many schools of public health, we need people to be trained in public health, which are critical. What we observed is that we need approximately 10,000 plus for the government sector, around 2,500 to 4,000 for NGO sector, 1,000 for the programs run by international agencies. These are the estimates of 2005-06. We also looked at the central level and district level and block level requirement of public health professionals like 100 and 600 and 3,000 and 10,000 respectively, to actually look at how many people are required, looking at the kind of positions which are available for the public health professionals. But what's happening in other parts of the globe? Let's talk about other countries also. Like for example, in nursing professionals or medical doctors, several countries, they have their estimates available. The estimates of density of doctors per 1,000 population or 10,000 population, the density of nursing professionals. But similar information for public health professionals is not available. We looked at one of the very interesting document which was the work of ASPH, that is Association of Schools of Public Health in United States of America. In USA, they have a ASPH, that is Association of Schools of Public Health, and this was work done in February 2008. And they looked at the need of the United States of America related to the public health professionals. And they defined public health professionals using the definition presented here. Because see, if you have a variable definition, your requirements will change. So the definition that they used is they included as a public health workforce, public health physicians, occupational and environmental health specialists, public health nurses, epidemiologists, biostatisticians, healthcare educators, administrators, health economists, planners, and policy analysts. This was the definition they used, because the numbers which are now being presented is according to this particular definition. And they concluded that United States of America faces a public health workforce crisis. Present means in 2008 and future also. And why did they say is like this? What they recommended is the benchmarking that has to be recommended for estimating the public health workforce. The suggestion is that we should use 220 for 100,000 population. How many public health professionals are required? According to them, 220 per 100,000 public health professionals are required in US. That was, they used the parameter. And that this number of 220 generated through a lot of iterations, looking at literature, a lot of stakeholder consultations, and it was a consensus amongst the group of the people who were involved, saying that we would estimate the requirement in United States of America as 220 per 100,000 population. And what they found is that they would require 250,000 more public health professionals would be needed by 2020 for the US population. And also they concluded that the schools of public health, the existing number of schools of public health in United States of America would have to train 3 times the current number of graduates over the next 12 years. Because 2008 they had done study and they were looking at 2020. So they had said that we have to produce 3 times more graduates from the schools of public health that they had. And of course then they talked about other things also, like institutionalizing and periodic remuneration. Like in India, in Medical Council of India, there is a registry. An MBBS doctor has to register. Of course that register is also challenging because People die, people migrate, people move, but they are still in the register. And at times, live register is critical and important who are into the public health practice. But for a public health professional, there is no register. For a public health professional, there is no council also, like nursing council or the council for medicine. But we don't have a council for public health also. So there is no registry that how many people are trained in public health and working in various disciplines of public health. And there are challenges surrounding this, but this is what has happened and reported in United States of America. Let's take another example of Brazil, which is one of the developing countries and large size country. They realized and scaled up their public health education. And this is a very interesting article which was published in WHO Bulletin, which talks about, and even the first bullet itself is the title of this article, that how Brazil turned one public health school into 40. They had only one school of public health. And they said that now we need people trained in public health in the country. And they scaled up from that 1 to 40 in a very limited amount of time. And how they did that is a very interesting WHO Bulletin article, and that Brazil now has a ratio of around one public health officer per 100 inhabitants. That's there, and it's one of the greatest concentrations of training programs in the world, and that's one course per 5 million inhabitants in Brazil. Because they realize that they need schools of public health, they need people trained in public health to work in the field of public health, and these are some of the efforts that they had done globally. As long as India is concerned, if you look at the public health professionals in India, there are no standards, no benchmarks available. As I mentioned that currently we don't have public health council, we don't have a register to register the people who are trained in public health. But suppose we use the ASPH benchmark of estimating public health workforce. What United States, the ASPH said, is 220 per 100,000 population. If we use for Indian population, we would require 26,40,000 public health professionals. Is it not? If you extrapolate that to, I'm not saying that from the policy perspective or planning perspective we should do that, but what I'm saying is that if ASPH has recommended 220 per 100,000 population in US, if we use that parameter for India, using Indian population, it translates to 26,40,000 or even more than that number of public health professionals to be trained in. Of course, this is from the perspective of looking at the requirement. It is not that these are the jobs available. It's looking at if you want to take care of the health of the people, you need many positions being created in the area of public health, and this is an ongoing process of building the career and building the public health cadre and saying that more positions are created. So what is existing? Let's move on to the third section to understand beyond these numbers for that matter for a while. Where are these positions? What kind of opportunities are available as a trained public health professional? Where can I go and find a job which is interesting to me? It can be classified from the perspective of the domains that one can think about, like for example, you would be interested in teaching and training programs. As I mentioned to you that there are 40 schools of public health. I also mentioned to you, if you look at the health management programs, it's close to 60 institutions, 58 institutions running the programs related to health management. Health and hospital management, again, plus 75 institutions running programs. There are institutions which offer specialized programs like epidemiology, public health nutrition, and other related programs. From a teaching perspective, there are some typical training institutions where a lot of training is being conducted. Government training institutions like health and family welfare training institutions, state health and family welfare training institutions in the states, where the positions for teaching and training are also available. But most of the teaching and training positions would require a PhD, because this is as per the requirements of the University Grants Commission. If you wanted to become a faculty in any higher education institution in the country, whether it could be public health or history or medicine or law or management, anywhere, you need to acquire a PhD degree. You can join initially as an MPH, maybe at the lower level, tutor or sometimes lecturer, but you need a qualification PhD to join as a faculty subsequently. Research is another area, public health research, and lot of, like in Indian Council of Medical Research, they have institutions across the country. And unfortunately, I have seen that many people train in public health, they do not venture and explore the opportunities into the ICMR institutes. National Institute of Occupational Health in Ahmedabad, National Institute of Virology in Pune, National Institute of Epidemiology in Chennai. There are several institutions, and they have positions who are interested in research. For them, the positions are available in these institutions where you can join as a research officer and senior research officer, assistant director, deputy director, director. And my students, I would tell that when I was teaching in a medical school who had done their public health training, MD in community medicine, they are now, at least I know 2-3 places, they are now the directors of these ICMR institutes. They went into the public health research arena. One of my student, Raj Tiwari, he had done MD and I was his mentor and guide. He was very clear while doing MD. He said, "Sir, I will also give some anecdotal examples because that's important to impress upon you." And he said that while doing his MD, that I'm keen to join research. He was very keen. So he got through MD and then he immediately, and his thesis was related to occupational health. He looked at the handloom weavers, respiratory morbidity in handloom weavers, and he was very keen on that. And then there was advertisement of Indian Council of Medical Research. He joined National Institute of Occupational Health at very lower level as research officer, and then he became a senior research officer, assistant director, deputy director. And then there is an institute in Nagpur, it's called the National Institute for Miners Health. Mines, coal mines, the miners' health. That's under the Labour Ministry. So then he was a deputy director, he applied for that position, he became a director there. And then the ICMR itself has an institute in Bhopal, that's National Institute for Environmental Health Research. And that institute was created when there was a Bhopal gas tragedy that some of you might be aware, that an exposure to the methyl isocyanate, the MIC exposure, which took the lives of the people. And so that's an environmental health institution, because environmental health and occupational health goes in hand. And now a few months back he joined director there. He's one of the youngest directors to join. A very determined person. One of my batchmates. Was very keen from the beginning when we were doing MD together. His name is Dr. Sanjay Gandhi. He works with the GSK. He's the vice president of GSK in Mumbai. So he was very keen. He said that, and how that keenness has happened is that as the students of MD program, we used to present seminars, to make the presentation to seminars, and his first seminar was on vaccines. So he prepared in very detail about the vaccines, and he made a presentation. It was a wonderful seminar. He had done a huge literature review, and it was very good for MD students. We all were MD students, and it was appreciated by our teachers also. And he decided that he will make a career in vaccines. So he graduated, then he worked as a faculty for a couple of years, then he went to WHO NPSP program, because that polio surveillance program, a lot of emphasis on vaccines. Then after having worked there, he joined PATH. Again he worked in Japanese encephalitis vaccine. Then he joined now GSK. He's a vice president of GSK and looking after the huge portfolio of vaccines in Asia. Very focused. I want to do, the first seminar, remember the first seminar in something, it may not be. And we still have a copy of his seminar, and I was cleaning my house at some point in time, so I got that copy and so I kept it, and then I had shown it to him, so I gave it to him, so he still remember that made his career, that the first copy of his seminar that was presented. Need to be focused, identify area, what do you want to do? I'll give many examples later on. Policy and programs. We need people trained in policy and programs. There are enough opportunities in the area of policy and programs. And there are no, programs in policy also. You talk to civil servants also who are involved in policy making, and they go to public policy training in some best of the schools globally. They go to Harvard, or they go to, Stanford and other places to learn the public policy, health policy. is extremely important. Policy analyst is also important. Public health practice that you wanted to do, you can get into a public health practice also as a public health practitioner. So from the domain perspective, in sector, you can work in public sector, you can work into the private sector. In public sector, the opportunities like working in the health department for that matter, the positions in National Health Mission. Now we are pushing for the public health cadre, and PHFI is actively engaged in advancing the agenda of public health cadre in the state, and we are after the states and the union government to push them to create positions for the people trained in public health with non-medical background. Currently, the medical background people, they get their MD degrees and they get into the public health. Those positions are available. But non-medical background people who wanted to come to the public health, for them, now recent policy we'll talk about subsequently, but 2017 health policy talks about and clearly mentions about the public health management cadre. And so that's the first step towards that. So that's there. Women and child welfare, even the defense and railways and public sector units, environmental, food and agriculture, urban development, rural development, road safety and transport, coal, you find public health positions. These are all public sector. These are all government departments where, like coal mines, you would have occupational health physicians particularly. You find that Western Coalfield Limited, Eastern Coalfield Limited, you have the WCL, the positions for the people trained in that. Private sector, NGOs, non-governmental organizations, a lot of NGOs are active in the field of health and even the social development. Then you have healthcare, like hospitals, the corporate sector, industry, like industrial physicians, as a factory medical officers and industrial physicians, the pharmaceuticals, medical tourism. I will give an example of pharmaceuticals, and sometimes people feel only the medical doctors can go. It's not true. People trained in public health are required in the field of pharmaceuticals. We'll talk in more detail subsequently, but the same fellow actually happens to be my friend, so we talk very frequently, and he said, Sanjay, we need health economists, because he said that we wanted to do a lot of economic evaluation and for our clinical trials data related to vaccines. And we need some people who are trained, or we need at least a couple of people who are trained in health economics, who can independently analyze the data and do and undertake the economic evaluation. And what he said is that, you see, I'm not interested whether somebody is a PhD or master's or diploma holder. I want a person who is able to do economic evaluation. I don't want PhD in health economics. Well, somebody is maybe PhD in health economics, but if that person is not able to do the job I'm expecting to do, then I don't think that person, or that, PhD degree, I don't want to frame it and put into my office board that I have PhD health economist working with me. The point that he was trying to make is that skills are important. It could be a postgraduate diploma in health economics, financing and policy. Even you may be a very plain graduate. Are you able to do? Because the whole world is moving towards now the skill-based and competency-based approach. When you will be hired, MPH is a qualification which makes you eligible for application. But that does not qualify you for the job unless you have the skills and competencies required to deliver on that job. I hire many people. Basically, my job is last few years I'm involved in hiring people. When I joined PHFI, we were 20 people. Now, close to 800 plus 850 people. So, at PHFI also I was involved. One of my responsibilities is to hire faculty for PHFI institutes, because as a chair of academic management committee, and the vice president of academics for all our institutes, one of my responsibility is to hire faculty. And so what I'm trying to say is that qualifications are important, but we look at from the perspective of, suppose I'm hiring someone, I always have a job in my mind. Suppose I'm hiring you for a particular purpose. So I know that what I'm expecting you to do once you join. And I would always ask myself the question that whether you would be able to do that job or not. Of course, your MPH qualification is important. But while we interviewing you, I will ask myself whether you will be able to do this job or not. Because I am hiring you not to actually show to the world that I haven't somebody graduated, but I'm hiring you because I want this job to be done by you, whether you would be able to do this job or not. It is that simple. And therefore, the competencies are critical and important when we talk about, even I mentioned, then the other area could be medical tourism, wellness initiatives, quality management, this CROs and SMOs in clinical research, they are very active organizations, IT, insurance, media and journalism. Some now CSR, corporate social responsibility initiatives have come up, many opportunities. Then international organizations, foundations and development sectors where the opportunities are available and one can explore those possibilities. But beyond demands, even in subject areas, like for example in epidemiology, the district epidemiologist is a position at the district level as a part of integrated disease surveillance program. It's called as IDSP, Integrated Disease Surveillance Project. Biostatistics and data management. There are many positions for data management. Demography or health management or hospital management, environmental health. Environmental health is again one of the promising area of 21st century. Because of the degradation of the environment that is happening and the impact of environment on the health of the people and climate change and so many other factors, we would require people trained in the area of public health to work in the field of an environmental health. Like HIT action plan and so many other things which are happening around. Occupational health, we'll talk in more detail, but this is one of the areas that I also worked earlier. Social and behavioral sciences, health economics, I just gave an example to you, nutrition, veterinary public health. You see the proportion of infectious diseases transmitted through zoonotic mechanisms, zoonotic infections. The interface between the animal and human beings. And because of the change in the environment that is contributing to that, there is rising trend of these infections and the issues surrounding that. Entomology, public health engineering, health informatics for that matter, the technology application, health informatics, health technology assessment, health promotion, health communication, journalism, public health laws. We have people trained in public health and we have lawyers. But lawyers don't understand public health. If you look at the Epidemic Diseases Act and so many, because there are so many legislations in the context of public health. Suppose smoke-free laws. So you need understanding of law also. You need understanding of public health also. And unfortunately there are no programs. But suppose lawyer, somebody who is a lawyer and coming for an MPH program, there is a huge opportunity to work in the area of public health legislations. And so many acts, even in the field of an occupational health, Workmen's Compensation Act, Factories Act, Maternity Benefit Act, so many Women's Compensation Act, Workmen's Compensation Act, so many acts, Mines Act, related to even in occupational health also for that matter. Therefore, we need to see the combination, and that's the beauty of public health, of its multidisciplinarity, that if you say really some lawyer is interested, or if you are like an MPH graduate, you do a law or having understanding of law, pursue your career as public health laws. This field is still emerging. Now health economics, we have a program. When I graduated, this country did not have programs in health economics. We did not have programs in health economics. I was very keen that I wanted to learn economics. I wanted to do economic valuation. I thought that unless I learn, how do I do that? So it was a short 4 days training that I had come to attend in PHFI. It was so basic. I thought that that's not going to help me. And those days then, because I wanted to learn health economics, I think that, I'm a medical doctor, so I know health. I was doing my MD also. So I thought that I know health, so health is not a problem. So then I did evening program separately in the university Department of Economics. So I did my MA in Economics. Has nothing to do with, medicine or health or public health. And whenever I used to attend evening classes on economics, whenever the professor was teaching, they were giving examples of, the typical economics example of business and other examples, both in micro and macroeconomics and econometric models and everything. I used to correlate in my mind with the health because, I had gone there to learn health economics. So I said that I know health. And then I learned economics in a pure economics department of the university by attending many classes. I acquired MA in economics as a degree also, and then I started using that learning and the health learning, and then I said that now I'm health economist. You know, it's a combination of I learned in two places, and then so I'm not trained formally as health economist, but then I did my two courses and trying to correlate that because the limited opportunities for that matter. So such kind of opportunities one has to look at. Public health laboratories is one of the areas, health policy, ethics, monitoring and evaluation. Several programs you need expertise in monitoring and evaluation. Many programs you would require monitoring and evaluation. You came from Inclane? You worked earlier in Inclane. Okay. She worked in Inclane, and 1996 we established a network. It was called as India Clan was existing there. It's a clinical epidemiology network. It's a India Program Evaluation Network. It's called as an IPANE. India Clan Program Evaluation Network. And we, as a part of the India Clan program, we created in 1996 the first study which we did. Dr. Arora might have told you, was the polio one actually. We evaluated the polio program. That was the first countrywide evaluation. So much opportunities available in evaluation. There is a network called as GEMNet Health, Global Evaluation and Monitoring Network in Health. IPANE is one of the example, and they do a lot of evaluation. Now there are other activities also, but IPANE still remains one of the important activity as a part of the Inclane program. And then why Inclane actually, even in PHFI, so many organizations do a lot of evaluation work, evaluation of the programs, impact evaluation, process evaluation, outcomes evaluation, that's going on. GEMNet Health is a network of 9 countries globally, and this network is basically promoting monitoring and evaluation as an important discipline of public health, building capacity in monitoring and evaluation, actually contributing to the national governments in monitoring and evaluation, the GEMNet Health. And with humility, but I would like to mention that currently I am the chair of this network. I have taken over the chair of this network in Mexico a couple of months back. It's 9 countries involved where we are trying to push the agenda of the importance of monitoring and evaluation as a part of the public health programs. What I'm saying is that you take these examples here and there are scope, there are a lot of activities in monitoring and evaluation, and we need people trained in public health with focus on monitoring and evaluation to work as a part of the initiatives that we have been doing. International and global health. Global health is close to my heart. I teach global health also, and so that's oral health, family. So these are the subject areas. One can also think about it, that what are the subject areas, adolescent health or maternal health, and what appeals to you. Just few examples that in subject areas, that what are the opportunities available in those areas. Some niche areas like infectious disease modeling. It's a very niche area. Tremendous scope. In 2008 actually, SARS, and the government of India was struggling to identify people in the country who can be counted on fingers, who can actually engage in understanding the disease dynamics and predict the numbers of the outbreaks and pandemics. The capacity in this particular area of modeling is so limited because you can't have long-term programs. There are limited people, some IITs and some of the institutions, and we also have at PHFI some of the colleagues who works in infectious disease modeling. This is one of the areas that I used to work a long time back, and very promising area, absolutely promising area that somebody wants to make a career, who needs to have a bit of interest and expertise in statistics and mathematics, a bit of advanced statistics. It's modeling, do a lot of modeling, so that's useful. Meta-analysis, systematic, no, it's a niche area, but even developing the expertise on systematic reviews and meta-analysis, even today, because a lot of pharmaceutical companies need expertise in these areas. They want somebody to do a systematic review of literature that is available. Lot of policy analysis requires systematic review. Lot of public health interventions require systematic reviews. and you create your own signature. Now, I will give an example. After my MD, I joined as a faculty. I did my PhD in meta-analysis long time back. And that time, even people did not know too much about it. It's absolutely advanced, epidemiologic analysis. And I used random effects models and fixed effects model to assessing the vaccine effectiveness. That was the work that I did for my PhD. And then I felt that this is one of the important areas, and because I was a faculty and a teacher, I used to conduct workshops on meta-analysis and teach from morning to evening for 3 days, continuously basically on meta-analysis and so on. So as a signature, people in meta-analysis, person that he knows some meta-analysis, you create your own signature. Even today people recognize you as the person you used to talk about and write papers in those days, 20 years back, even more than that, 22 years back. You create your image. So that time, even today also, the capacity in the country in this particular area, advanced statistical analysis or big data analysis is limited. I have not seen Dr. Habib Hassan is sitting here. I should mention about this infectious disease modeling. So Habib will tell that how much is the scope in this area if you really wanted to develop as an expertise in this area. He spends a lot of time with Imperial and London School, working with some colleagues in Imperial and London School. Am I correct, Dr. Habib? So I'm just talking about some niche areas basically, because public health is public health, huge. But you have to identify what appeals to your heart and then getting into that, like big data analytics. Again, MPH is a general public health qualification. You do PhD in big data analytics and getting into that area, GIS, policy analysis. Even the areas like grants writing, medical writing, a lot of pharmaceutical companies, a lot of organizations, even if you have a good communication skills, good writing skills, that would offer you a job. Good NGOs, and not only NGOs, good organizations, Incline would offer you a job. What we need is that we need proper expertise. If you are good at writing proposals, good at writing grants, good at writing papers, I will give you a job why tomorrow, why not today? So because we new organization, people approach to us that we need this expertise. Now you would say that these are the skills, but writing skills itself is important. Those skills are also important. Entrepreneurship in public health, generally people don't talk about it, entrepreneurship in public health, but which is important. Why not to create own NGO? Maybe not immediately after MPH, but maybe with some experience, and there are very good public health professionals in this country who have established their credentials by creating these setups. Like Dr. Abhay Bang and Rani Bang at Gadchiroli district in Maharashtra in Search is one of the NGOs, and many NGOs I'm saying that. Pavitra Mohan used to work in UNICEF. He worked for several years in UNICEF and left and started his own NGO in Udaipur. Sharad Iyengar is one of the person who has his own NGO in Udaipur again. Mirai Chatterjee, who is on the board of PHFI also, she had done her MPH from, I think, Harvard, and she has started her own NGO, and Seva Ruler is one of the most promising NGOs. So you can start your own NGO also, where you can have your preventive care setups. Two students of mine who started with the preventive care setups, advising on non-communicable diseases, risk factor modification, and that kind of stuff. And they started consultancy. You can have your own consultancy firm also, like this McKinsey and all those kind of fields. So you can do a consultancy also for that matter. Of course, these opportunities may not be available immediately after MPH program because that would be too much of a daring. But subsequently, you can actually think about these opportunities also. But what matters at the end of the day is, do you have the hip pocket competencies to deal with? Because what is critical is, you need competencies. Qualifications are necessary, but they are not sufficient to provide you a good job. They are necessary. Without qualification, people will not recruit you because that is required. That is necessity, but it's not sufficient. You have to build your own skills and competencies. You must have something in your pocket to say that, yes, this is something which I know better than you. Then probably you would be able to create a niche in that area. Now, I will run through important slides, typically taking some examples, like career opportunities in occupational health. However, in occupational health, even in today in India, because this is for public health professionals we are talking about, but to work in the field of occupational health as a factory medical officer, you need that DG Fastly certified course that needs to be done, and positions are even today available only for medical doctors, particularly industrial physician kind of positions. But if you look at the total workforce in organized sector in India is close to 27 million. And currently employed factory medical officers are 7,000, and our requirement is 17,000. So we have a deficit of around 58% of factory medical officers in India. And this is the published document actually. And I mentioned to you that all the numbers that I am presenting to you have a long story behind these numbers, which are reflected and written in these papers that you can look at these numbers and study it more detail. What I'm trying to make is that even if you wanted to do a career in occupational health, this is one of the areas that you can go. Industrial hygienist for that matter. A total of 5,000 plus industrial hygienists would be required in India. That's an estimate that we had come out, and estimated deficit was found to be around 50% of industrial hygienists based on the current ratio of employment in the country. I'm talking about, these are the areas like in health management, the career opportunities in health management. An estimated requirement is close to 20,000 professionals, both in public and private sector. And how we arrived on these numbers, you can read these papers there, but I'm just trying to mention you that there are opportunities available in specified areas. For example, when I talk about the health management, I must mention you about the National Health Policy 2017, which I referred earlier. The recently launched National Health Policy of 2017 clearly mentions about public health management cadre. And you don't read this, but this is a verbatim from the policy I picked up for your understanding. The policy proposes the creation of public health management cadre in all states based on public health or related disciplines as an entry criteria. And they also talk about, if you see that the policy recognizes the need to continuously nurture certain specialized skills in the field of entomology, housekeeping, biomedical waste management, biomedical engineering, communication skills, management, much more broad spectrum. Doors are opening up. Opportunities are coming up. And through the health policy, the commitment of the Government of India to create the public health management cadre would require people trained in public health management and people trained in the health management. Hospital management. The estimated requirement was estimated to be close to 22,000 people, both in public and private sector. And this is the paper that we looked at career opportunities in health economics and financing and policy. In fact, Habib is the lead author on this paper, and then we estimated that time the requirements of 2,700 as the professionals we wanted to be trained as part of the health economics and policy, and annual cumulative output that we looked at was 50 per annum, because we had hardly programs in this country. So we need people trained in these areas. These are all niche areas, the health economics or health financing, and within that also, like you take an example of an economic, you can make a career as an expert in economic evaluation. Health policy, translating public health research into policy action remains critical, we all know that. And therefore policy development, policy analysis, implementation of policy, but limited expertise is available in policy analysis. And I mentioned to you a lot of civil servants from the country go to public policy programs in best of the schools globally. So these are the opportunities again available as a part of the health policy that they are available. Epidemiology, that's very close to my heart because I am an epidemiologist, but the estimated requirement that we had estimated is 3,300 and then wide gap in demand and supply of epidemiologists in the country. We need people trained in epidemiology. I will give an example. When Integrated Disease Surveillance Project was created, program required epidemiologists in each district, but we did not have people. We recruited people from the social sciences background and management background and other background because the program was there knocking the doors. And we did not have programs to have the people trained in epidemiology. And then once the program people have joined, subsequently now they were trained as a part of the routine training as a part of IDSP, and then we also developed some distance learning programs, and then country had made some efforts to train people in the area of epidemiology. So those kind of opportunities are available. Urban health, because we all understand that the urban population is growing and will have a rapid increase in the urban population over a period of time. Now the concept of the smart cities has been propagated not only by the government of India but internationally several organizations, several countries are working towards that. Urban health is also one of the emerging area of 21st century because a lot of urbanization, challenges surrounding urbanization. So we need people trained in urban health. We need competence in urban health. Now urban health mission is also being conceptualized and thought about. And therefore, capacity building in urban health and related issues remains critical. Similarly, and taking another example of like infectious diseases, I talked about infectious disease modeling as a niche area, but even in overall looking at infectious diseases, limited veterinary public health capacity in the country. You would see that the sizable number of infectious diseases, they are zoonotic infections, vector-borne diseases. It's very substantial, a grim reflection of the developing world's underpreparedness to address the zoonotic risk, because capacity is limited. We need people trained in these areas. We may not require thousands, but at least we need few people to be trained in these areas who would be able to contribute. Suppose somebody is interested in infectious diseases, can pursue a PhD in this particular area and become an expertise in this area. National Center for Disease Control and other institutions in the country would require people trained in this area. Medical entomology is one of the areas, because vector-borne diseases, emergence and re-emergence, they are contributing to major epidemics. Why only epidemics, but even pandemics for that matter. So that's also one of the areas, and then we estimated that we would require at least 1,000 specialists in medical entomology to be trained in this country, and all the details are provided in the papers that I talked about, but I'm just emphasizing some of the areas. This is also a paper where we looked at the career opportunities for MPH graduates, and we will, Shanti, you email this paper to everybody so that you can read it in more detail. But we talked about what are the potential career options and opportunities and challenges both in public and private sector as a part of this paper, mainly focusing on non-medical background graduates trained in public health. You know, because MPH graduates, you have some people with medical background, but quite sizable number of people with non-medical background. So what kind of opportunities are available? This is the recent paper. The Shanti wrote this paper. She did a good job of looking at the public health job opportunities in India, and from the employer's perspective. She spoke to several employers and collected data. So this is the study of the employers of the public health graduates who recruit public health graduates, and it focuses on various job opportunities for public health graduates and understanding the changing trends in recruitment of various public health profiles and desired competencies from the employer's perspective. You know, what they want from the employer's perspective. And she reports, you can grill her, on high demand for competent public health workforce. You know, so that's the major conclusion. But looking at from the employer's perspective, having said this, still there is a need, demand and supply paradox, because we have public health challenges in the country, but to respond to these public health challenges, we also need people trained in public health. But sufficient number of positions are yet to be created. They are still in the process. Private sector and public sector both, all these jobs and opportunities that we talked about, some of areas where they have completely opened up, some of the areas they are in the transition of opening up an opportunities and jobs. Some of the areas still, you know, they are closed door, and maybe in next few years probably opportunities would emerge. And in that context, we did the mapping of public health jobs and estimating the requirement of the job and creating job opportunities. So efforts are also going on, and as a PHFI, we are playing an important role in this particular area of public health as pushing the agenda for creating more positions for public health professionals and public health cadre and those kind of things. But having said that, still there is a need, demand and supply paradox, because we say that there is a need, but it needs to be translated into actually having positions being created. The another opportunity could be a doctoral program or another master's program, Somebody may be thinking that I studied my MPH and that ends the story. No. If you are interested in maybe policy, you can go a master's program in policy analysis, and may not be typically in public health, but a policy analysis, public policy analysis master's program. And because you are already trained in public health and you go for that training, so that combination will give you a different set of competencies. Or if you wanted to do, you go to London School of Economics and then pursue your economics program, master's level economics program. So with this MPH and that combination would give you the different set of skills which are required. Or you wanted to do MSc in infectious disease epidemiology. So some specialization master's program can also complement your MPH program, or otherwise directly going for a PhD or a DIR-PH program. Some of you may also think of actually spending a couple of years in the field and doing some public health practice and public health work, and then after a couple of years thinking of going for a PhD program. Because what MPH program offers to you is basics of public health. Because in 2 years, because public health is such a vast, there's so much to be learned. In that context, it's still basic. But you need to understand what is your passion in public health. You wanted to really go for a research, you can go for a PhD program or a public health research. You wanted to go into the practice, you go on to the implementation research. You have a good communication skills, teaching skills, you love teaching and training, then you can join schools of public health as a faculty after your PhD program. Identify the specific area and domain. Where do you want to do? And then you can explore either PhD or DIR-PH. DIR-PH is a doctorate in public health program in many universities, and then postdoc fellowships, then another master's. And the opportunities are available both at the national level and global level. Even in India also now there are good PhD programs if you really wanted to pursue, or you can go for some international program in public health. Initiate preparation well in advance, because you need to be focused. As I mentioned to you a couple of examples that my students, and I had seen some of my colleagues, they're very focused. They were very clear that what they wanted to do, and they did it. So you wanted to be focused, that you decide, yes, you wanted to make a career in vaccines, do it. You are after MPH, you be focused on that, and you continue to pursue your understanding, your knowledge, your skills, your experience in that particular area, and you will be one of the shining stars in that particular area. Nobody actually does everything overnight. It's a continuous perseverance and struggle over a period of time. You work in a particular field for 5 years, 10 years down the line, you will be known globally. If you work in a very specific area, you continue to work in that area, you will be known. You don't have to tell people. In my days, there was no this Google and very limited access and the internet, and so it was there but very limited. And so it was acceptable in my days. Suppose I tell somebody that I am epidemiologist, or I am health economist, I am this and I am that. Today you tell someone, people Google you, you don't have to tell. Because people just Google you. You don't have to tell that you are expert in infectious diseases, or in particular area of policy. People will Google, policy experts, policy expertise. What I'm saying is that you don't have to tell. You don't have to tell. People Google you, you understand your whole profile, and nowadays everything is available in public domain. And therefore, what I'm saying is that you continue to pursue interest and expertise in a particular area, you become expert in that area, and people will invite you. You don't have to run. See, if you work in a very niche area, you don't have to run after anybody. People will run after you. People will be after your life. You will get n number of opportunities, and you will be saying that I wanted to do this job or that job. But you need to be focused, continue to work several years, and then thereby you will be able to do that. And therefore I said that simultaneous capacity building. So what you are doing an MPH program? Are you reading something else? You can also enroll for some distance learning program. Suppose you are interested in GIS. So you do something work in GIS, your project in GIS, you learn in GIS. If you are interested in some area, industrial hygiene or something, so you do some program there. Nowadays, a lot of e-learning opportunities are also available. So you can enroll for those e-learning programs and enhance your CV also. Because you will be able to write in your CV that I have done these courses, additional courses, or additional skills and competencies. So that is also important. So preparing for the future is also important, because we are living in now 2017. And how will India in public health look in next 15 years, 25 years? Down the line, 10 years, 15 years, 20 years, 25 years. That also needs to be figured out. Because at that time, you will be 40 and 50 and in charge to run the country. At the age of 45, 50 years, you will be in a driver's seat and you will be running the country. So the skills required at that point in time, you have to think today. You have to see that those skills are acquired by you, and because therefore we say that you need to equip the competencies to deal with the public health challenges of 2032 and 2048, 42 and not of 2018, because you will be joining 2018. That 2018 problems. So one has to look down the lines 10 years, 20 years, and therefore the current and future drivers like digitalization, automation, globalization, these are going to impact public health hugely. While choosing even the career option at this point in time, one has to figure it out, how do you actually keep yourself on toes and updated in the context of the impact of all these parameters of digitalization, automation, globalization on health and in future. Of course, advancing the public health agenda for us is extremely important because we continue to showcase public health as a field, and we wanted public health to be recognized as a profession, but that will happen only when we create a value. Unless you create a value, if you bring a value on table, people will respect you. If there are 4 people sitting and you join them, if you bring a value in discussion, if you bring a knowledge in discussion, if you bring something new in the discussion, people will be impressed and people will listen to you. And therefore value creation is important, enhancing quality is important, systematic efforts towards creation of job market and strengthening public health leadership, these are some of the issues advancing the public health field are important. Now we transit and we'll finish maybe in 10 minutes on the placement perspective and placement related issues for the IIPH graduates, and these are all on-campus programs. We have integrated MSc and PhD in clinical research and health informatics. We offer MPH program, then postgraduate diploma in public health management, then associate fellow in industrial health, that's the industrial physician qualification that we talked about, then short courses in basic data analysis for the health sciences. So these are the on-campus programs that at PHFI we offer, and we always try to see that our programs are the best programs, and we are able to provide you best of the skills and competencies required to stand in the market. And in that context, we say that what are the unique features that we have and how our programs are distinct than the other institutions. We offer programs at 5 institutions, including Bangalore and Shillong. We are yet to start, but we would initiate the long-term academic initiatives from Shillong also soon. So currently we have 6 on-campus programs, and you must have visited PHFI website also. Now plus 20 distance learning programs being offered in various domains of public health, and you would have seen that our faculty is multidisciplinary. You've seen that people from different, like you will be taught public health nutrition by Suparna and Jyoti, who have background of nutrition, or infectious diseases by Dr. Habib. He brings that on the table. Maybe epidemiology, we have some colleagues like Himanshu must be teaching you epidemiology for that matter. Management, we have Shamik. So what I'm saying is that multidisciplinary faculty is one of the need of public health, because public health is multidisciplinary. Competency-driven curriculum, very clearly spelled out competencies at the beginning of the program is important. You are from a diverse background, and that's a richness that you bring to the classroom that we believe, and practice-oriented courses, a lot of emphasis on health systems, connectivity and transformative learning, because we believe that we want to create change agents, not only public health graduates, and therefore we say that we need to move from informative learning to formative learning, and from formative learning to the transformative learning. Informative learning means transfer of information. Formative learning means socializing the values. That's a step beyond that. And transformative means actually creating champions. So we want each one of you as the public health champion. Each one of you must be a public health leader. Each one of you must be a change agent that wants to change public health of this country. And that's what should be the motivation for yourself also, and for us as an institution to create change agents who are the future of the public health of this country. Because I would like to see 20 years down the line, 25 years down the line, you are leading the efforts, public health efforts of this country. you will be recognized as responsible for keeping the aspirations of 1.3 billion people of this country. And in that context, that much more bigger dream that we think about, and therefore the even inbuilt quality assurance mechanisms are there. Shanti must have talked to you that we have placement cells at PHFI and IIPHS. The functions of the placement cells also has been deliberated to you. Placement policy is there. There is a placement mechanism and process. Code of conduct for the students is important. She reminds me that whenever I interact with you, I must tell you that there is a code of conduct for the students also, and we'll talk about it, and expectations from the students also are there. So this is the placement cell at PHFI and IIPHS. I don't deliberate on too much, but Rajesh, Nivedita and Himanshu are the three faculty who are the course coordinators, and then program managers and program officers are the part of the placement cell of the PHFI. And these are the beautiful brochure and poster that talking about the PHFI placement cell. And you'd be happy to see this graph. Are you happy? So what is the probability that you would be offered a job in 3 months of your graduation? That for me is 93%. Because 93% of the graduates, there's placement statistics. So the probability you would be able to find a job in 3 months' time of your graduation, of course some of them would get you even during the internship and program, the project work, it's 93%. So 90%+ is the probability. The faculty and the placement cell is very active. I am also available, and we would be very happy to facilitate your placement in best of the places. Of course, there are challenges, and at times people come to our public health, and one of the MBBS graduates I met some time back at the airport, and he came to me and says, "Sir, are you this and this?" I said, "Yes." "Oh, I heard about you." "Fine, you heard about me." Then he said, he checked with me that, I did my graduation in medicine. I wanted to go to public health. And therefore, who would be the best person than you to advise me? I said, I was sitting at the airport, so I said, "Oh yeah, that's fine." So I asked a simple question that, "What do you want to do?" "I want to go to WHO headquarters in Geneva and work there." I said that there is no public health there actually. But you go to the primary health center, work for a couple of years, and then we will talk. You go to the PHC. So what I'm saying is that when you talk about the jobs and opportunities, keep in mind all these dimensions and dynamics that we'll talk about. These are the organizations like IIPH graduates are currently working. You find that some government organizations, some private organizations, and our alumni are working here, and we are proud of them. Some of them are doing wonderful jobs. In fact, most of them are diploma holders because we started with postgraduate diploma programs. But we are proud of them because they are doing great job. They are change agents of public health, and some of them we are really proud of the contribution that they are making to the public health. But last couple of slides, and I would ponder a few minutes on these slides. You need hip pocket competencies and 21st century competencies that I mentioned to you, but I wanted to reinforce that educational qualification is necessity, but it is not sufficient. You must have those competencies where you are shining differently. Communication skills are always underscored, both written communication skills and verbal communication skills, because at times you may be knowing something, but you need to be street smart. This world is that you need to be street smart. You may be very good in your technical work, and that's fine. You must be competent technically, but while talking to the people, articulating your thoughts, putting your views across, you need those skills also. So participation in discussions, intellectual discussions, contributions in those areas are very important, and that would happen with the communication skills. And don't underestimate yourself. At times we say that, "Oh, no, I am not at good communication." Everything can be acquired, and there are several examples globally that people were shy, people were not very good at communication skills, but systematically, strategically, and consciously they invested in improving their communication skills over a period of time, and then they became the great leaders, the great orators, the great communicators. Professional and personal development, see, when you spend your time You spend time mostly on your technical competence and skills, but maybe 15 to 20% of your time spend on personal and professional development. You read outside public health, and I like reading and I love reading, and therefore I recommend reading because I have seen the benefits of reading. You pick up any random book which is non-public health, you read it, and we also ensured that we have now so many books in the library also. I know how many of you have checked on that, but there are many books which are non-public health books also, written by good authors like Professor Amartya Sen and so many other authors, and you can read those books because finally that matters. Job is one thing, that you will get a job, that don't worry too much about getting job, you will get a job, but look at from a larger and longer perspective, there you would find that. Preparing for an interview, Shanti has planned for you how to write a cover letter, how to prepare your CV. Even the mock interviews are also being prepared. I think we have shared the calendar with you, so a faculty will be sitting and they would be conducting the mock interviews. So you will find somebody will be interviewed for UNICEF position, somebody will be interviewed for some NGO position, somebody will be interviewed for, so the whole idea is to train you in giving an interview. How do you articulate, even preparing for an interview, dressing up and documents, and then how do you respond. Technical knowledge is important, but all these skills which are also important. And finally, hard work and perseverance is not a one-time engagement. Nothing can be achieved in the world without hard work. Perseverance, I would strongly encourage you, be focused, continue to do good work, continue to do hard work, which is extremely important. There is no shortcut to the hard working. Like I tell you, we find people and nobody has reached the levels overnight. It's a long, toiling, many years that people whom we know, they have reached that level. The amount of hard work that they had put in is huge. And we all create your own signatures. So you close your eyes and think of anyone, and you think of that person. So it's not that you created that image has been created by that person. So suddenly you close the eyes and think of somebody, and immediately certain things comes to mind. Immediately certain, good or bad, but comes to your mind. Somebody is punctual, somebody is not punctual. You take the name of X person, will say that this person, one says he will do or she will do. And for some another person, even if he or she says, yes, I will do, but we know that she will not do or he will not do. So all these images are created by those individuals. These are not created by us. So create your own signature and image, which actually is your own image basically. So you are known in that field. So that's how we create all images. Accept criticism and shortcomings. There is nothing to you can't be perfect in all the fields of your life. So this is also important. I know certain things, but I know them. I don't know certain things, that is fine, I don't know. It's not necessary that we are good at everything, but identify limitations and try to overcome those. Identify there are like one area that or one department I wanted to improve, invest time in that area, improve in that area, think of other things that I wanted to improve and continue to improve. So all these things are also important from the jobs point of view, career point of view. These all are critical and important. Proactive engagement is important. Then from the institutional perspective, I would like to specifically mention that we have a placement policy and processes and code of conduct. You have to follow them. And don't think too much about materialistic things in your life, I tell you, very honestly. At times what happens is that, and that is very logical. When I was also young, probably thought that way, that salary, kitni hai salary, that is more important. How much is the salary that I will get? Oh, only 35,000. Or now, because you are 46 students and Shanti will find a job. Ab kisi ko salary, suppose you may be very bright and you get a job and you are paid some 40,000 rupees per month of salary. And he gets a job and he gets a salary of 45,000. There is no comparison, 42,000, 45,000. If you see a long run in your life, it hardly makes a difference. Even nobody would remember this salary, what you got initial. You got a job in UNICEF, I am working in some NGO. What matters is that the first job that you get should provide you an experience, a good experience, good work culture. That is more important than these materialistic issues of life. 5 years down the line, you continue to work. You see, the first job of yours is an extension of your education. Don't think that now because I have got a job and so I don't have to learn. Learning is a continued process. That is through life actually. And therefore, even in the first job, it's a continuation of your learning and education that is happening. And in that context, don't look at any job as the salary or place. In public health, make your hands dirty. Go to the urban slums, go to the rural areas, go to the hard to difficult areas, go to Jharkhand and Chhattisgarh and work those areas. It's not that you wanted to sitting in the air-conditioned offices. There is no public health there. The public health is in the actually experience in public health you would gain when you go to the most of the tribal areas, rural areas, hard areas, where you would gain that experience which would be useful. So the location of the job that I don't want to go to Chhattisgarh or Jharkhand and this and that doesn't work for that matter. Even that if you are working in that NGO tomorrow, you will have such a good experience that you would get better opportunities than a person who is spending a desk kind of a work in the public health. So the job profile versus salary, and treat this job as procuring experience, at least in initial years, and permanent versus contractual jobs. In the labor market, nothing is permanent. I tell you, nothing is permanent. Even government jobs also now, where trends are there. There are no pensions and all that kind of stuff available. And so all jobs are contractual, so nothing is permanent, and therefore you always needs to be on the toes also. So don't get into these nitty-gritty issues. What's more important is that think through a point of view of building a career in public health. Because building a career in public health, and for that you need hard work, perseverance, determination, continuous engagement, proactive engagement, and thereby you would contribute, because public health is a noble profession, you would contribute to the nation, and thereby we would say that we are contributing, creating Swasth Bharat along with Swachh Bharat. It's the motto of the Swachh Bharat, the government of India, but we wanted to create Swasth Bharat, healthy India. That's the motto. Don't worry too much about your jobs and careers and salary. They are instrument to create a Swasth Bharat. That's what I wanted to make a point. So thank you so much for this opportunity.